move on to the scenario number 3. And once again, I welcome Ms. Qatar to read the third scenario. Ms. Qatar, please, and thank you.
Okay. What are the CPT and ICD-10 CM codes reported? A 58340, 74740, N97.9. B 58340, N97.9. C 58345, 74742, modifier 26, N97.9. D 58340, 74740 with a modifier 26, N97.9. Location, Regional Hospital. Hysterosalpingogram examination. Hysterosalpingogram procedure performed by radiologist. Indication, infertility for 15 years. Patient had one child 15 years ago. Last menstrual period was 1/13/2024. No history of pelvic infection or surgery. Comparison, none. Procedure, the examination and anticipated discomfort was discussed with the patient. A plastic vaginal speculum was introduced with the patient's legs in the stirrups following preliminary vaginal examination and lubrication. The posterior vaginal fornix and outer cervical os were prepped with a cleaning solution. A 5F hysterosalpingogram catheter was used. The catheter balloon was inflated in the lower uterine segment. Fluoroscope, I can't get it out, and radiographic assessments were done. The patient tolerated the procedure well. Findings, contrast was administered through the catheter and multiple images were taken. There is a possible abnormal contour to the right corneal with patchy contrast opacification, which may represent intramural contrast with intravasation. No definite spillage of contrast from either fallopian tube was identified. Impression, number 1, possible right corneal contour abnormally manifested by focal extravasation and minimal intravasation of undetermined etiology. Recommend endovaginal ultrasound for further evaluation. Number 2, no contrast filling of either tubes and no spill into pelvic perineal space. Coders, you have 2 minutes to solve.
Okay, Chorus. I was just looking into the chat, and you all have been rocking it all. Great, great responses. So we have regional hospital hysterosalpingogram procedure is performed by the radiologist. A vaginal speculum was introduced. Hysterosalpingogram catheter was used. Inflated in the lower uterine segment, fluoroscopic and radiographic assessment were done. Contrast was administered. And yes, patient is here for the indication of the procedure is for infertility. And that's all we have. So what happened in this procedure is that a hysterosalpingography procedure was performed, and hysterosalpingography is an X-ray procedure that is used to view the inside of uterus and fallopian tubes. So it is often used to see if the fallopian tubes are partly or fully blocked. So the procedure involves injection of the contrast material and taking X-ray images as well. So here you can see it in the slide how an hysterosalpingogram procedure is performed. You can see how a catheter is introduced in order to introduce a dye or the contrast materials, and several X-ray images will be also taken at that time in order to see if there is any blockage in the fallopian tubes or not. Okay, so let's come back to our coding portion. So in the procedure inventory, we do have hysterosalpingogram and diagnosis inventory. The indication of the procedure was for infertility. And these all are our CPT codes. So option C, 58345 is coding for a trans cervical introduction of fallopian tube catheter for the diagnosis and or re-establishment of the patency with or without hysterosalpingography. So option C is incorrect because in this procedure, the provider introduces catheter through the cervix into the fallopian tube to diagnose and clear the blockages of the tube. So we didn't had a trans cervical catheter introduction into the fallopian tube in this scenario. So that's the reason why option C is incorrect. And now let's look into option B, 58340, and that is coding for catheter introduction of catheterization and introduction of saline or contrast materials for saline infusion, sonography, or hysterosalpingography. And that CPT is actually a good one, and that does match with our procedure inventory, but still option B is incorrect because the parenthetical guidelines says that for radiological supervision and interpretation of hysterosalpingography you have to use the CPT code 74740 along with 58340, which is not there in option B. So that's why I would say option B is incorrect. And you can see the radiological supervision and interpretation guideline, the SNI guidelines, which says that an image is used and is not included in the surgical procedure or medicine service. How many codes should be reported? And the answer is 2. And one of the code is from the surgical section, from the surgery codes from the surgery section, or the service code from the medicine section. And the second code would be the radiological supervision and interpretation code from the radiology section as well. So we have a code from surgery section but don't have the radiologic supervision and interpretation code in option B. So that means option B is incorrect. And now between option A and option D, uh, yes, option D is only difference is that option D is having a 26 modifier attached to it, and we have 74740 as well. That would be hysterosalpingography, radiologic supervision, and interpretation. So in this scenario, though, it was not mentioned that the hospital employed the radiologist. You can see it was said here in the second line that the procedure was performed by a radiologist, but it's nowhere mentioned that this radiologist is employed by this regional hospital or something like that for that to be a global procedure. So we are coding for a professional service provided by the radiologist as well. You can see the impression also. So it would be appropriate to append a professional component that would be a 26 modifier. Yes, so the professional component has to be appended for the reading and interpretation, and it's used by the physicians as well. So definitely in this scenario, we have to give a 26 modifier, which would eliminate option A, and the correct answer is going to be option D, 58340, 74740, 26 modifier, and 97.9. And yes, I can see most of you have got it correct. Great job, coders. So if you have any doubt, please let us know. So let's move on to the next scenario, and next we are going to review the pathology and laboratory section. So yes, so we have the first scenario over here, scenario number 4 of this Tuesday night. So Miss Katoya, please, and thank you.
Okay, what are the CPT and ICD-10 CM codes reported? A88104, E10.22, N18.6, Z99.2. B88108, E10.22, N18.6, Z99.2. C 88125, E10.22, N18.6, Z99.2, and D 88106, E10.22, N18.6, and Z99.2. Requested by R. Simon, MD. Cytology report collected 1/26/2024. Received 1/27/2024. Pathologist performing the service is an employee of the lab. Specimen source A, peritoneal fluid. Specimen description 100 milliliters of yellow fluid. Cytopreparation 2 CCF. Pertinent clinical data and clinical diagnosis 26-year-old female with end-stage renal disease ESRD due to type 1 diabetes presents for elective kidney transplant. Cytologic impression peritoneal dialysis drain fluid. No cytologically malignant cells are identified. Comment: 100 milliliters yellow fluid is received from which 2 pap stain cytocentrifuge slides are made. Slides contain mesothelial cells with a spectrum of reactive changes and histiocytes. No malignant cells are identified. Coders, you have 2 minutes to solve.
Okay, good answers once again. So let me walk you through this one. We have a cytology report here. The pathologist performed the service in the service, and he's an employee of the lab. The specimen source is peritoneal fluid. We have end stage renal disease due to type 1 diabetes mellitus. 2. Papaniculi stained cytocentrifuge slides were made, and the correct answer is going to be option B. And these are our procedure inventory. We have cytopathology on peritoneal fluid cytocentrifugation technique was used, and diagnosis inventory. We do have end-stage renal disease due to type 1 diabetes mellitus. So cytopathology is a study of cellular changes in disease states such as cancer, infection, or inflammation. And let's look at option B, which is coding for 88125, and that is for cytopathology of forensic materials. So in 88125, the lab analyst usually performs the technical lab test to analyze cytopathology specimen for forensic analysis, which didn't happen here. We had a cytopathology of the peritoneal fluid, and that was not for any forensic analysis. So option C is incorrect. Option A, 88104, that is for cytopathology, fluids, washing, and brushing. So in CPT code 88104, the lab analyst usually prepares a smear of cytopathology fluids by washing or brushing, except for the cervical or vaginal fluids, and interprets the findings. So again, we didn't have cytopathology of the fluids, which was prepared by washing or brushing. We had a cytopathology on peritoneal fluid, which was made by a centrifugation technique. That would eliminate option A and option D as well, because that is also for cytopathology fluids by washing or brushing by simple filter method. So option C is also incorrect, and the correct answer would be option B, 88108, which is for cytopathology, concentration, technique, smear, and interpretation. Yes. So the test performed here is cytopathology on the peritoneal fluid, and the documentation indicates that it is cytocentrifuged, which means the fluid was removed to concentrate the cells or for the smears placed on the slide. So yes, so cytocentrifugation, that's a kind of a concentration, and that's why option B is your answer. Okay, so did the explanation help, coders? Yes, the concentration technique is same as centrifugation. In the centrifugation, the fluid will be removed in order to concentrate the cell. Okay, great, awesome.
Thanks for tuning in, and until next time, happy coding.